Welcome to Toledo Clinic TV. Our guest this segment is Scott Sylak. He is the Executive Director of the Mental Health and Recovery Services Board of Lucas County. And there is a need for mental health services and substance use services in the community. How big is that need?
The need is big. I mean, almost every family that we come in contact with, through our daily lives, have a need for some type of mental health treatment services or substance use treatment services. All families have been impacted by this. And, in Lucas County, the Mental Health and Recovery Services Board is the statutory agent, the lawful agent that kind of helps manage all of those services and the availability for people who have private insurance, as well as people who might not have insurance and still need those services.
And so how accessible are some of these treatments for people who need them?
There are literally 30, 40 agencies in our community alone that will provide this service. And of course, there's private insurance, private licensed individuals that do this work as well. But the Mental Health Recovery Services Board really focuses on those individuals who cannot afford treatment services in particular, and we act as a safety net. So folks that might need mental health services or alcohol and drug services can actually go to an agency that is in our system of our network and receive the care they need that is paid for by tax dollars.
Is that a problem in the community where people know that they need help, but there are some barriers because how do you pay for that help?
We often say people don't know where to go until they actually need the help. Just think about what we do in our daily lives. We don't know what services are out there until we actually say, hey, we might need this, and then you go and find it, right? So people don't understand what all services are available in our community. So we've actually made it easy for folks to do this. We've actually created what we call a recovery helpline. And so it's one number, 419-255-3125, and that is available 24/7, 365 days a year. Somebody can call that line and they can actually talk to somebody who can walk them through the steps and actually schedule an appointment with that agency so they can get the help they need right away.
And this might mean treatment for, when you say mental health, depression,
anxiety, even harder, more serious, even more acute services such as schizophrenia, major depressive disorders that are recurrent, substance use disorders that are very acute that might require a detox or a residential service, ongoing care, medications, housing services for those that are most significantly disabled, potentially homeless, those types of things.
Let's briefly talk about the stigma surrounding mental illness. And is that a barrier for many people still today, even though many conversations exist about how common mental illness is?
Stigma is the #1 barrier for people getting care. There is a negative aspect in our community about those people who have substance use disorders or those people who have mental illness. And so people don't want to be labeled in that way. And so, what we need to do is we need to change the conversation about what that means. The American Medical Association clearly defines substance use disorders and mental illness as a brain disorder. It is a disease, and it needs to be treated as such. And so the conversation in our community, we are actually attempting to try and change that conversation by bringing these kinds of discussions out in the open and letting people know that it's not just their family that's impacted, but it's my family that's impacted. It's most families that have someone who needs these services.
So the bottom line is you will help people no matter what situation they're in. You will help them get connected to those resources they need.
Absolutely. With the recovery helpline at 419-255-3125, that is available 24/7.
Okay, great. Thank you. Very important information for people to know. We appreciate it. And we'll be right back.